Young children come to us with lots of struggles. How do we help them with challenging behaviors? This video is a summary of the presentation Responding to Challenging Behaviors, Considering Two-Generation and Infant Mental Health Frameworks in Early Childhood Settings, given by Dr. Katherine Lingras on October 29, 2018. This video was created for early childhood providers to learn more about challenging behaviors, where they come from, and how to respond in ways that best support young children and their families.
Challenging behavior really is kind of shaped by our views, our expectations, and our identities. So I really want to encourage us all to think to ourselves as we have this conversation, what are our beliefs that surround behavior and behavioral expectations? How might our own beliefs be different from the child's in front of you or the family in front of you? And how do our own views and experiences affect how we as providers are influencing and interacting with the families that we work with around that challenging behavior? Behavior, even challenging behavior, is a way of communicating either an unmet need or desire, an unlearned or unmastered skill, or a disruption in development, a disruption in their environment. And so often when we see those challenging behaviors, we see them as those things like hitting or kicking or spitting or running around or doing things that are disruptive, right? And so we can kind of think of those behaviors as sort of the shark behaviors, right? The things that are scary, the things that kind of give us that foreboding music feeling. And so if we see on the surface, we see a shark fin, what are we gonna do? We're all gonna run away, right? Or swim away. We're gonna stay away, or we're gonna get really scared. We're not gonna wanna interact with that shark, right? But if we look under the surface and we see it's actually a goldfish with a Halloween costume of a shark on, right? Then we might feel a little bit better. It might feel a little bit easier to interact with that goldfish than a shark, right? And so this idea of kind of being a behavior detective, of really digging in and seeing what's going on underneath, in order to answer questions like, instead of what's wrong with the child, why is this challenging behavior occurring? What happened to this child or in this family? What is this child trying to tell us? What need isn't being met? What are they trying to communicate? So a couple of ideas that we can think about in terms of why challenging behaviors happen are some of the basics that we don't always think about at the beginning. Things like sleep, hunger, feeling sick. All of us can kind of relate to those things as adults too, right? If anybody woke up feeling under the weather this morning or didn't get enough sleep last night, we know that our emotions and our behavior might not be 100% of what they normally could be. We also know that children experience changes in their lives that can impact them in lots of ways that don't necessarily impact adults. So things like moving or changes in school, even positive things. In many cases, moving can be a positive thing, right? If you're moving from a smaller house to a larger house or to be closer to extended family, that could be a positive thing, but it certainly still involves a lot of change for children. Things like parental separation, we also know really impact kids. And again, even small trips, things like that aren't necessarily long-term separations can be impactful. And that doesn't mean that they're impactful long-term, right? So for anyone who's ever gone on a business trip or had a partner go on a business trip, don't worry, you haven't ruined your child for life, right? There's a lot of opportunities to prepare and kind of bridge those separations. But we know even those short amounts of time can be impactful for young children, and they show us that through their behavior. We also know that things related to developmental delays, either cognitive delays, emotional delays, language delays, those can all be things that can result in some challenging behaviors. And we know that things like environmental influences can have a big impact on young children's development, even from infancy. And so things like poverty, neighborhood and community violence, racism and discrimination can all be things that children pick up on either explicitly or implicitly that can impact their development. We also know that parental mental health concerns like maternal or paternal depression, any caregiver history of trauma can impact interactions with their young children, which can then impact their development. So I usually put this in, especially in groups where folks are not familiar with this idea, because a lot of people think it's about putting babies on couches. And certainly we all know that that's not the case. It is much more about the idea of developing abilities to experience and regulate and express emotions, developing those close and secure relationships with primary caregivers, and exploring the environment and learning, all in the context of family, community, and cultural expectations for young children. And so we often talk about this idea of early childhood mental health as synonymous with social and emotional development. And similarly, we have a real opportunity to have a prevention focus. So by nature of working with the youngest children, we can really actually kind of nip things in the bud as we see them coming up as possible concerns. So particularly when we think about using these principles, what this looks like is that we try to meet with infants and parents together. We really allow the parent to take the lead, both in the interaction and kind of choosing the topics for discussion. We start with where they are and kind of work from there. And we really try to identify and enhance the capacities of the parent or caregiver. So things that we already are seeing, even if they're just little threads, we try to identify those and kind of pull them out so that we're working on those from those successes rather than starting with a list of here's what you're doing wrong. We really try to remain open and curious and reflective, and we use this idea of wonder a lot. We wonder about the infant and the early childhood, the young child's experiences or feelings or the parent's experiences. And we also really try to respond to the caregiver's history, particularly things related to abandonment or separation or loss, because those are also things that are really going to come up as important when we think about parenting a young child. And then, as I mentioned, we collaborate. We work with other people, other fields, other professions to be able to identify and treat the young child and the parent and their relationship together. So when we talk about a two-generation approach, we're really talking about creating opportunities for and addressing needs of both the children and the adults. So there's not one definition of family here. There's not one kind of picture of what it looks like. And we're really focusing on integration and enhancement and collaboration across systems. So you can see kind of the whole family in the middle there, and on one end of the continuum is a child focus, and on the other is the parent focus. And as we move towards the middle, we're trying to incorporate elements of each into the other. We're really trying to align parent and child interventions. We're considering that family context, and we're really also addressing that intergenerational trauma or stress that families may have experienced. And our goal here is to really achieve outcomes that are beyond just an individual. So we're not only looking at parents, we're not only looking at child. We're looking at the goals together for the whole system and the whole family. And so when we think about kind of bridging those two worlds, the two-generation approaches and the infant mental health approaches, this really gives us an opportunity here because we know that becoming a parent often is a very important kind of sensitive period of transition to change. So becoming a parent can really help parents to reflect on what they're doing in terms of their parenting, in terms of their own lives, and it also gives us an opportunity to impact the actual brain functioning. It's an opportunity to talk about previous experiences, either ghosts, things that didn't go as well in your childhood, or angels, those protective caregivers who were helpful, who were your sort of cheerleaders or protective figures. And it also tends to be an openness for parents to mental health supports or reflection or functioning, because parents are really concerned with how they're going to help their child. So I've had many parents, and in fact, several parents that I've seen or supervised students seeing, that parents would not have been, and specifically say, have not been interested in going to their own individual mental health support, but they'll bring their child in, right? They're coming in and they're saying, well, I really want to help my child. Sometimes I want you to fix my child, but often I just want my child to be better. I want them to be happy, right? And over the course of that work together, at some point, parents start reflecting on their parenting. And in many cases, they start reflecting on their own experiences of being parented. And that opens up a door to having conversations that they would never have been okay with or interested in having before. But all of a sudden, it's there in the room, and it gives us an opportunity to start to address some of those issues, sometimes that include trauma, and in ways that they may not have been open to before. We also know that this opportunity of combining the two approaches can really give us an opportunity to invest in parents, not only as parents, but individuals and agents of change themselves, not just for their child, and gives us a chance to approach the whole family and family level goals and integrating perspectives from across. And so we know that trauma also can impact a parent in terms of their own abilities. So trauma can make it difficult for a parent to kind of recognize what's safe and unsafe and the ability to keep their children safe. Parents who are kind of fighting for their own survival or fighting against previous traumatic histories or triggers might even experience their own children to be a threat to their well-being. That screaming or excessive crying might be a trigger to an experience that they've had before. It also can really impact parents' abilities to stay in control of his or her emotions. And especially when we're talking about children who are showing us some of those challenging behaviors, which we know are already stressful, can make it even harder for those parents to stay in control of emotions and response. And dealing with stress in healthy ways. So we know that parents who've had trauma histories are more likely to engage in negative coping strategies. And most importantly, from our perspective as providers of young children and families, we know that the experience of trauma can really impact parents' ability to trust other people and especially to trust providers. So one of the ways that we can think about doing this is to really think about being proactive instead of reactive. So in those moments, how do we step back and think about ways that we can prevent those behaviors from starting rather than how do we put out the fires when they happen? So when we think about being proactive, we want to think about building those relationships with children and parents and your provider team. So whether that's teachers or physicians or home visiting teams, making sure that you're building those relationships among your own team in order to support the parent and the child. And using our attention. So as we build these relationships, particularly with children and parents, they're really going to value us. They're really going to value our attention. And so how and what we give attention to can be a really powerful message in terms of what behaviors we want to see or don't want to see. We also know that predictability is really important in preventing behaviors, particularly for young children. So thinking about how we set up rules, routines, transitions. And again, this can work in lots of different spaces. Even in a 20-minute visit with a medical provider, you can set up routines and transitions. So thinking about how we do those things. And then teaching expectations. So again, if we think about that challenging behavior as communicating an unlearned skill, we need to teach those skills, right? So in order to teach the skills, we can use praise, encouragement, clear instructions. We can also think about using an active ignore. So again, thinking about where we're giving our attention, what we're giving our attention to, and what we're not giving our attention to. And talking more about kind of specific predictable consequences. And again, this is an area that we can think of that really actually increases children's understanding of safety because it goes back to that predictability piece. So if you do this and this is the consequence, then children start to know and learn that that is the expectation. And then if they don't do that behavior, if they violate the expectation, then this consequence will happen. But they know that it's a safe and predictable consequence. We also want to teach skills related to language and social interaction, emotion understanding, and expression and regulation. Typically for kids with trauma histories, and I think actually everything that has come before this are things that help all kids, right? But for children who've experienced trauma, we know that there's some additional things that are really kind of key for them as well. And again, vice versa, these are things that are going to help all kids. So nobody was ever hurt by having a safe and predictable environment, right? We all as adults can appreciate that as well. But children who have experienced trauma really thrive and value that. They need those positive relationships and connection, the targeted interventions, the rich experience to kind of stimulate that brain growth, education around trauma and the links between social and emotional or cognitive difficulties, and then addressing those things directly. And so a few things to kind of think about, general strategies for parent engagement, just greeting them, saying hello, how is your day going? Good morning, how was the night? Using their names, sharing information about their child, providing information about child development or about what's going on in your classroom or in your setting or at that age that they are through newsletters or flyers or handouts. And then thinking about, particularly for those quote unquote difficult parents, really focusing on building that relationship, meeting the parents where they are, and remembering to kind of how you are in those interactions is as important or more important than what exactly you're doing.
So to summarize, challenging behaviors have cultural and contextual influences. Behaviors have a message, and we can search for the meaning behind them. Using an ecological perspective helps identify why behaviors happen. And finally, infant mental health and two-generational approaches give practical ideas for responding to challenging behaviors in young children.